Welcome to Keeping Up with Our Community, a podcast for and about Romeo Community Schools. Each week, we will invite different guests to share insights about some unique aspects of our schools. This podcast is powered by the MIT TV of Romeo, Michigan. If you're looking to start a podcast for your business or personal use, look no further than MIT TV. Their in-studio podcast experience allows you to record perfect audio and capture amazing video. That's all right here at the MIT TV of Romeo, Michigan. Contact them now via email for a free consultation and schedule a visit at mit.tvpodcast@gmail.com. That's mitt.tvpodcast@gmail.com. Hello, my name is Marianne Brush, and I'm the Communications and Marketing Supervisor for Romeo Community Schools. It is my pleasure to introduce episode 34 of the Keeping Up with Our Community Schools podcast. Today's episode will focus on stigma and will be hosted by Mary Selden, Director of Special Services for Romeo Community Schools. Our guests today are mental health professionals Kristen Famiano, 9th grade Academy School Counselor, and Kelsey Frazier, District School Psychologist. I will now turn it over to Mrs. Selden to lead the discussion.
It is my pleasure to be hosting this episode of Keeping Up with Our Community Schools podcast. After receiving feedback in our winter 2023 climate survey, parents asked for more resources on mental health and other wellness strategies. Our goal is to continue to create more resources on those topics and others to help students, parents, and staff in our community. As always, if you or someone you know is experiencing a mental health concern that impacts your daily life, please call your doctor. If you or someone you know is having thoughts of suicide, please dial 988 for free confidential help 24/7, or call 911 for emergency help. Our topic today is on stigma, and I'm so happy to have Kristen Famiano and Kelsey Frazier here with us today to talk about this topic. Stigma is when someone sees you in a negative way because of a particular characteristic or attribute. This happens all the time, unfortunately, with mental health. Types of mental health stigma are public stigma, where negative attitudes that others have about mental illness can impact the way that you're seen or treated. Self-stigma, where your own negative attitudes that people with mental illness have about their own conditions can impact the way they act or feel. Structural stigma, or policies that limit opportunities for people with mental illness, such as lower funding for research or fewer mental health services. What are some feelings that can be associated with stigma that can be associated with mental illness?
The first thing that comes to mind with stigma is outside stigma, stigma within society. So one of the common feelings associated with that is fear that somebody with a mental health condition is dangerous, that they're violent. And all the research shows that people with a mental health condition are more likely to be victims than they are to be a perpetrator of a crime. Now, that's understandable. People see inexplicable things that happen in society. And, you have to think that person cannot be okay. But I think attributing it to mental illness can be a dangerous thing because it does perpetuate the stigma and it does interfere with people's ability to seek help because of that stigma. That can cause fear within society, make it more difficult to disclose information and get help. Another feeling that can come about is shame, and that's for somebody with who has been diagnosed with a mental health condition. Likely that person knows that something isn't right that's going on in his or her world, but they not necessarily, they think that maybe I can control it. There's things that I can do to help, and then if they get the diagnosis, sometimes they feel a sense of shame. Parents often feel shame that it's something that they did because of what's considered bad parenting, which isn't at all the cause. Environment does play a role. However, that is, parents and their parenting styles and do not cause somebody to have a mental health condition. And there was often historically a lot of blame thrown on to mothers in particular if there was a diagnosis. Kelsey,
Yeah, no, I was just going along with that is sometimes it makes people feel as if they have to hide a secret identity, or even like parents have to hide this secret identity of their kids because there is shame attributed to it. Like, they can't talk about it because they're afraid of the stigma that it holds, or people won't trust their kids, or kids can't trust other kids, things like that. Isolation, feeling kind of alone in their feelings and thoughts. I think that that's a big one we see. And just frustration and hopelessness because they feel alone and then they feel unsafe to talk about possibly what they're feeling because of the stigma that it's attached to mental health. I think those are the biggest ones that I see as well, working with people and, working and knowing people, just in general.
Yeah, so we have societal, we have self-stigma, and then, the structural stigma. And that gets into a little bit of the weeds of, dealing with insurance companies and providers. But when we deal with stigma structurally, we often refer to as parity, mental health parity. So parity is treating mental health conditions in the same manner with, and the same coverage as a physical illness like asthma, diabetes. If I break my arm, that it's treated in the same way. And in 2008, there was a federal Mental Health Parity Act that did close the gap for employee groups of 50 or more, where it indicated that if, mental health was a coverage, it had to be treated in the same manner. Before the Mental Health Parity Act of 2008, there were limits put on therapy visits. You could only do 20 a year or a certain number. They had lifetime caps on certain services. And if you were in an employee group of 50 or more, then that closed a lot of those gaps. Now, then it went to the states, and every state has different parity laws. And Michigan just passed a parity law in May of 2024, so just a few months ago. And it closed that gap further, and it also included services for addictions. So the gaps are closing. I think people are recognizing that these are the same. But even as we reference the illnesses medically, they're often labeled as different things, even though it's dealing with the brain, which is something that I was listening to somebody talk about stigma, and they said we give more attention to the gallbladder than we do, the brain. And this is a diagnosis that involves the brain. So I'd also like to point out structurally that right now, inequity still exists with providers, because I don't know of any other specialty other than psychiatric where providers don't take insurance at the same rate and same level. If someone wants to see a cardiologist, a neurologist, they take insurance. And for mental health and for psychiatric reasons, many providers and many of your best providers don't take insurance. And even if you have good insurance that does have parity, some places that you can get into quickly, or they don't take insurance. And that is creating even more of a separation and a disparity between psychiatric, conditions and other conditions.
I always find that interesting, though, talking about, getting the help, because it gets in the way. You can't give people what they need. We have medical disabilities or medical things that pop up, and we treat it. And we have a limit on how we treat people with mental illness. And that's always shocking to me, because it is very treatable, and it makes people feel less alone when they are treated and have access to other people that are experiencing things. So I'm always fascinated with that end of things.
Right. And many of these people are people who go into the field because they truly are passionate and want to, be a change maker for these people and to provide that support. And sometimes dealing with the systems and structural systems can be difficult to, paperwork and some of the roadblocks that they have to go through. And many of the providers that I know feel that they can provide a greater service by not taking insurance because they're not limited by some of the qualifications that are needed. And so I've come I used to have a little bit more of a hard feeling about people who didn't take insurance, but I've come to understand what they've had to go through and some of those structural barriers that they have to experience too. Because, I think the idea is is that these services are also preventative. And so there's a lot of stories about how preventative care we don't pay for, we don't put a lot of effort and energy into until somebody actually does do something that might be harmful to themselves, and then now all of a sudden the insurance kicks in, and now everything kicks in, and now millions of dollars later, or if we put that money up front and preventative, that person's quality of life could be so much better and greater and fulfilled. And I think that's a goal for everybody, whether they take insurance or not. It's just there are that just creates other boundaries or barriers.
We preach early intervention, and there's so many barriers. Even talking with parents when they're trying to find the support, it's hard. There's a lot of loopholes that they try to cut through because we want to get it in or get someone in early or get that help earlier. So it's good to hear that there's been some changes along the way to support that.
There can be harmful effects associated with stigma, and we must acknowledge those because those are the big barriers that people are trying to overcome. These could include discrimination, such as people may treat someone negatively because of their mental illness, which can be obvious or even subtle, underlying. Social isolation, where people may avoid someone with a mental illness, which can lead to feelings of hopelessness or shame for the person that's suffering. Lack of help. People may be reluctant to seek help or treatment due to fear of that stigma. Poor well-being. Stigma can affect people's well-being, even with their mental health problems. And then how do we limit these harmful effects? How do we overcome them? For me, it is talking about it. It's sharing your story. We talk so much about social media and the harmful effects of social media. But one thing that I think is wonderful that social media has given us access to is it gives people platforms to speak about their challenges and things that are going right in their life, things that they're struggling with. And we have so many good examples now of people sharing their story, whether it's with a medical condition, a mental illness, other things going on, parenting challenges, and we identify with those people and connect with them and praise them for sharing their story because we know it, we feel it, we live it ourselves, and with our families. And I don't think social media necessarily gets credit that it deserves for sometimes how it can unify people, especially those who feel isolated and may not know someone in their direct circle personally that they can connect with or reach out to.
Yeah, and I also think that, to kind of resolve the harmful effects is some self-reflection on, everyone has some self-reflection on, what their beliefs are or catching themselves in those thoughts of possible, those stigmatizing thoughts. So for example, you see someone with depression and some people automatically think, oh, they're attention seeking and get over it kind of thing. And if you catch yourself thinking that, or, saying that about somebody, challenge yourself into understanding empathy and saying, okay, how hard must it be if I was experiencing it like that? Or even if I'm doing it for attention, man, that's pretty extreme. How, that's got to be hard. So kind of understanding your own thought process is a really big key, I think, to kind of stepping forward into understanding how things can be harmful or thoughts can be harmful towards people. And then just, communication and having resources be visible and normalize it. I think those are really big things.
I think there's a lot of deflection too. Sometimes the things that upset or challenge us the most about someone else is something that we need to work on or someone close to us needs to work on. And that's what makes people so passionate and so opinionated on how people deal with things. So look from within. Why do I feel so strongly about that? What can I do? Is there someone in my life that this applies to? And kind of redirect that focus and analyze where that's coming from.
Yeah, and I also feel that sometimes the way we talk and the words that we choose are important as adults, as what we teach our kids and how they describe things. And we are a very educated society who can find words that best describe what is happening without using stigmatizing words. I challenge people all the time to use a different word than crazy. especially when crazy is used in a negative connotation, with a negative connotation. So what are you trying to say when you say that was crazy that happened? Sometimes I say, just use unbelievable. That was unbelievable. I saw this happen. I couldn't believe it was unbelievable. Using words like crazy, it perpetuates that stigma. Now, I understand that that's a word that's become very common, and I'm not saying if you use it, you hear it all the time, but when using it in a negative way, again, that's what I'm talking about here. Really try to find a better way to describe what's happening. Another example is people using actual diagnoses to describe, for example, the weather in Michigan, especially in the fall or winter is, one, you wake up, it's, your car's frosting and you go to bed and your air conditioning's on and it's the weather is not bipolar. The weather is erratic. The weather is, just, it's unbelievable. Michigan weather. It's just Michigan weather. And then if someone goes into a cleaning frenzy, or if someone is more tidy or does, washes their hands a lot because they are in a school more fearful of germs because, there's a lot of illnesses that go around, it doesn't make them, OCD. Like that person's so OCD they have. So I think choosing our words a little bit better, to describe what's happening around us and in a non-judgmental way, I think is good. And also how we think about ourselves. And a lot of times we are the worst judges on ourselves. So if I'm feeling a certain way, if I'm feeling sad or depressed, it's okay. And not to put that judgment on myself by saying, come on, you're better than this. You're stronger than this. We're not going to be happy all the time, and it's okay to be sad and depressed, and without the judgment that's attached. But especially when it deals with our daily feelings, and especially somebody who has been diagnosed, because when we say those things and we put those judgments out there, we are sending messages. We don't know who's sitting behind us, around us, and remember that 25% of people will be diagnosed with mental health conditions sometimes in life. And so when I say that out loud, if I say that out loud, I could be the person across from me or next to me could be experiencing that, or a person's relative. It affects, 1 in 3 households. So it could be someone's, uncle, aunt, cousin. And so we really should be careful about how we verbalize and describe things around us. It does affect the people around us, even, consciously, or even just putting in the back of their head that if they do come out with a diagnosis, that it's not okay to talk about because everybody will think I'm crazy.
Mm-hmm. Yeah, I just think sometimes those words paint a picture of something that it's really not, and I think that that's where that open communication goes, where you keep that, the lines open when you're talking to people about, all this mental health stuff. And I don't know, I think the misjudgment happens a lot with just the word and not understanding what the word actually means, or even knowing they just kind of do that quick psychology of like, oh, it's this. You look like, oh, you're having an OCD moment, things like that, all that stuff they throw out there. And you're like, no, it's so much bigger than that. And you just minimized what people are feeling or going through. So then it kind of brings up that shame and that isolation of like, I'm just going to keep that part of me secret because or it could feel like a joke to people, like where
it's trivializing.
Yeah, it's minimizing my experience of what I go through on a daily, and it's nothing like the weather, but you just made a joke of it, or and so I think that that's a huge thing, where that communication and knowledge and educating others and showing empathy. I think empathy sometimes is lacking significantly, and that's a hard skill to teach, but it's teachable and you can kind of, walk in other people's shoes. I think that's a big, big thing.
A lot of our social communication, a discussion on the topics, even jokes, focus on such a minor piece of each of these conditions that, just like we talk about whole child, we need to be thinking whole person. Right. And people oversimplify and generalize all the time and kind of, pigeonhole these diagnoses, into a certain set of criteria. They are not medical experts, and they don't know the struggle that people are going through. Yep. And so just choosing, like Kristen said, to use words that are open and inviting, to have conversations on various topics that are difficult and challenging, and maybe sometimes, taboo or controversial of all different kinds, can just show how you're open to each and every person, to listening to them, what their needs are, what they're going through, and you being a safe space and a safe person to share information with.
And I'd also be remiss not to mention stigma within different demographics.
Right.
None of us around this table are men, but stigma for men is I'd say even more so there than anywhere else. It's hard for a man to seek help because it's perceived as weak. I'm weak if I'm not able to handle what's going on around me. And whenever I've listened to podcasts over the summer on mental health, and some very strong men have been on these, and this is a podcast where it deals with people that are in Hollywood or on TV shows of from all walks of life. And I hear, it's a man who leads the podcast, and the men who come on, they're like, they often say, I wish I heard a man say that earlier. Or, when football players come out, or, it's very, I think it can really speak to some of our young men in our district. And it's I can't imagine how hard it is for them. Also, there's stigma within religious groups. A lot of times, I think I've seen, people's places of worship play a huge role in getting people help and support, and help them make that get the help they need to be, the person's best self for themselves, and their connection to their religion. And I've also seen places of worship have the opposite effect, where people need to they feel that means their connection isn't as strong as it needs to be, and they need to pray harder, or we don't do that in our religion, or we don't seek that treatment. And again, I say that without judgment. I have my own thoughts on that. But sometimes our place of worship, they can help. They can be a huge support of within our treatment, and sometimes they do get in the way of it. That's just a fact. So
I think all of us at the table here have had numerous parent and family meetings over our time working within the school district too, where we see a cultural or religious impact. And again, unfair blame to families, unfair blame to moms especially, can occur. And it really limits the conversation when people feel that there's barriers to the positive choices they can make to help their children, help their students, help their family members get the resources and support they need. One of the most difficult things that I see is, a denial to help, receive support from social workers and counselors within our school district. And there's so many positive resources, and it can be as light or as deep as you need it to be, but just absolute refusal out of fear or misunderstanding of what the intervention is a common topic that comes up.
I was going to say that in meetings with parents who are trying to solve problems or, get on the same page, a thing that gets in the way is the fear of stigma. So I don't want to say too much because I'm so scared of how you might react with that information, or blame me, all that. And that does get in the way. So the more we normalize the conversation and educate the conversation, then the resources are more visible. So then it becomes more normal. Like, I need help. I'm stuck. I'm in a rut. This doesn't feel normal. And I'm not feeling normal. And I know that I need help. And that's okay. And we shouldn't fear, or we shouldn't have families fear their students asking for help, because, everyone is there. But the stigma sometimes is so powerful.
Right. And I'd just like to remind everyone that we follow FERPA confidentiality and privacy of all students and the information you share with us. Only their direct team of caregivers have access to any information. And so that should truly never be a barrier to accept our support. And we're here to help you as families, and we're here to help the children in our schools.
Yeah. And we often work alongside community agencies and organizations, and are happy to work with, people that parents trust. We've had experiences with grief and loss, and we've had pastors come in and to help. And we are definitely, there's not a judgment there, and we our goal is to work with the family and what their values and beliefs are, and make sure we support that along with the student, and without judgment. It's important for us to be non-judgmental with this, because the only way that we can work together to get the student help is to work together, and that's putting some of that aside because this is a medical issue, and the more we focus on it being a medical issue, the greater that stigma will come down, because again, it's involving our brains and how our brains are operating and functioning, and so much research going on right now about different, mental health conditions. And I was just reading an article about a week ago about schizophrenia, which is often diagnosed in early 20s, and a keto diet, and they're finding a lot of promise with that, and so just different things, different research opportunities out there, and we're learning more and more every day, finding genetic factors, and different our speech patterns, and there's so much research going on right now that's helpful, and we're learning more and more every day, and we're staying up to date on that.
Yeah, and I think that the main thing that I'll end on is, especially for families that we work with, or just in general, is we understand that's not your child's identity or someone's identity. It's a feature, that's something they go through, but they are so much more than that. Right. And we go into it knowing everything they are, and that's just a part of what, hurdle they might have to work through. But it also is something that can make a student really resilient and strong, because that will give them perspective in the future to understand others. So it's sometimes, not minimizing what they're going through, but it can be like this really cool superpower to understand the experience of others that others might not. So, again, just trying to diminish that stigma for families of like, we see so much more than, your fear of what what you may tell us, because there is way more to a person than a hurdle or something, that they're dealing with.
So the pandemic has definitely brought up conversation more and more about mental health and well-being. I think it's so interesting, the research going on right now, like Kristen was saying, and to me it makes a lot of sense. We need to think of this as a medical condition. Mm-hmm. And for example, the keto diet makes tremendous amount of sense, because keto diet works for people with epilepsy. So that is a brain condition. And so looking into those connections and then relating it back to mental health treatment, just, is where we should be focusing our power and our resources.
Well, it goes back to when someone has diabetes, they need insulin. When someone has another medical condition, they have medicine. It's the same thing. So if you need something, you get treated for it. And whether that be medication or that be talk therapy or something else,
many times a combination right. of things.
Yeah. So it's a medical condition that can be treated.
Yeah. And I guess the thing I want to end on, my message to everybody that I work with that has been diagnosed with a mental health condition, is that mental health conditions are extremely treatable. Treatment is effective, and students and everybody who has been diagnosed can go on to fulfill their every goal and dream, their family goals, their career goals, their goals and dreams that they have out there. This is not, nor it should ever be, a limiting factor on, their ability to succeed in the world. And that is one message that, that I always send. Definitely these, individuals struggle. It takes some time. It's hard work. And there's, and if they do the work, and if the families they have support behind them, they can, be successful and fulfill all their goals. And there are people in this world, and because people don't talk about it, we don't know about it, but there are CEOs, lawyers, doctors, the people in the trades, construction workers, welders, people, very successful people with families that are living with this mental health condition, just like they live with other conditions like asthma and diabetes and things like that. So that is my message, this is something that you can succeed and live with, and hopefully not feel shame about.
Right.
Well, the good news is there's ways we can all help.
Mhm.
Some ways to challenge mental health stigma include speaking up when you hear negative comments about mental illness, talking openly about mental health with friends and family, learning facts and figures about mental illness and sharing them with others, standing up to misinformation about mental illness, telling your story if you want to, joining a support group, and many, many others. All right, I'd like to thank everybody for being here today. We are incredibly grateful to MIT and to Romeo Community Schools for helping us share this information. Kelsey and Kristen, thank you so much as always. You are a tremendous support to our students, to our staff, and to our community. And I really value your input and dedication to the people in our district.
Well, thanks for having us.
Thank you. Thank you.
Next up is our first in a series on this year's theme of purpose. We will visit with teachers, administrators, and staff as they share their personal purpose statements. Thank you for joining us, and tune in next week to keep up with Romeo Community Schools. This podcast is powered by the MIT TV of Romeo, Michigan. If you're looking to start a podcast for your business or personal use, look no further than MIT TV. Their in-studio podcast experience allows you to record perfect audio and capture amazing video. That's all right here at the MIT TV of Romeo, Michigan. Contact them now via email for a free consultation and schedule a visit at mit.tvpodcast@gmail.com. That's mitt.tvpodcast@gmail.com.